Hey everyone, Luke Gordon here, and welcome to the third video in this series, which is all about lymphedema and chronic swelling. So if you didn't have a chance to catch those first two videos, please check those ones out first, or the blog post, depending on where you're looking at this from. The first one was all about just understanding what lymphedema means and what the lymphatic system is and how that works. So I have the drawing behind me there. We won't go into that today, but that's a good just introductory video for you to understand what we're talking about. Second video then was all about all these various causes and underlying factors you have to consider when you're dealing with chronic swelling and lymphedema, trying to determine which of the systems are involved, which ultimately is going to lead you to today's topic is how do you treat it. So if you've got this ongoing swelling in your arms and legs and abdomen, how do you figure out what's causing it? Is it more associated with the veins and the lymphatic system, which we talked about last video? So how do you figure out what's going on? And then lastly, so for today, we're going to talk about once you figure that out, what can you do about it? So I'm basically going to describe our treatment approach here at the clinic at Gordon Physical Therapy, which again, I don't personally do, but we have two therapists right now that do as I'm making this video. And I made this point pretty emphatically in the last video, but I'll just reiterate it again, is that when you're dealing with these issues, chronic swelling and lymphedema, you really want to work with someone who has specialized training in the topic and who really knows how to differentiate between the different systems that can be involved, which again, there's a lot of things that can be involved. And just like when you're treating anything, you have to know what you're dealing with before you can, expect to successfully treat it. So that's what I'm going to cover today, though, is we'll look at how we treat it in the clinic, the treatment approach, and that should give you an idea of what it could look like for you. So we break it down into 4 steps, essentially, for treating lymphedema and chronic swelling. And the first step is that we're going to look at they are going to look at your skin and make sure you don't have any active infection or cellulitis. So if you recall some of the functioning of the lymphatic system, it's to help get rid of excess fluid, and it's also basically like filtering your blood and it's exposing it to your immune system. And as long as that's working smoothly, you've got a nice functioning system. With lymphedema, though, that stuff gets backed up. So the fluid isn't going through nearly as well as it should. It's starting to pool, causing that swelling and lymphedema. And so it's just not as good as a system then. And so you're more likely to develop infection and cellulitis, which cellulitis is basically an infection in your skin. So step 1 then, we want to make sure that we look at your skin and start to pay attention to anything that might be going on there. So that's step 1. Step 2 then is they're going to introduce exercises that are specifically going to help to pump the fluid through your lymphatic system. So basically, if you look at, again, I wasn't going to refer to the drawing, but here we go. If you look at your blood, the way it flows, in your arteries, you have blood pressure. So your heart beats and you can feel the pressure. If you ever feel your pulse, that's an artery. By the time it gets through your tissues back into your veins, there's no longer any blood pressure. And that's the same thing with the lymphatic system. So essentially what those systems rely on is you and your body to pump the blood back towards your heart through the valves in the vessels back towards your heart. So in step 2, we're looking at specific exercises that are going to help just kind of start pumping the fluid through the system. So that's step 2. Step 3 is where the specialized training really comes in for our lymphedema therapists, because this is where we look at manual lymph drainage. So manual meaning hands-on, lymph drainage. So there are very, very specific techniques that they use with their hands, stroking techniques, to move the lymphatic fluid through the system. This again is where it gets important to understand is this an issue with the lymphatic system or an issue with the venous system, or is it both? Because if you're trying to move fluid through the lymphatic system, it's a very specific amount of pressure and touch, and it's a very specific type of movement with the hand, so like a massage stroke. So very specific. It's very light, actually. It's a very, very light lymphatic massage, and it's a very specific direction. So that's the lymphatic system. And then if you're dealing with the venous system, it's a different type of pressure, a different type of stroke. And I won't go into all the specifics, but it's just very different. And so you really have to understand which one are you trying to work on with which technique. And again, you can be working on both at the same time, but again, you have to understand which one you're trying to clear first. How do you clear it? So that's where it's very in-depth training for our lymphedema therapist to know how to do that. And again, that's manual lymph drainage. That's step 3. Step 4 then, depending on the issue and what's going to work best for you, we're looking at different types of compression. So compression meaning you're putting pressure on the system to help the fluid continue to move and to not backpool. So we could be looking at compression garments, compression bandages, and then there's compression devices like pumps and different things like that. Again, you want to know what you're dealing with so that you can figure out what type of pressure is best for you, whether it's a little more pressure with the venous system or a little less pressure with the lymphatic system. So again, just to highlight the importance of knowing someone, working with someone who knows what they're doing, that can help you with the compression process. So those are the 4 steps. We're checking the skin, we're getting the exercises that are helping to move the fluid, we're doing manual lymph drainage, which you need to do with someone who's trained in it, and then compression, various types of compression. So those are the 4 components to successful treatment of lymphedema and swelling. The 5th one that I would throw in, which is what you're going to do on, on the ongoing basis with physical therapy or towards the tail end, is self-management. So ultimately, if you can learn some of the compression techniques, there's pumping type devices you can do at home. There's different garments you can wear. If you can learn which ones work best for you, that's going to help with self-management. And then a lot of the clients that come through the clinic, the lymphedema therapist will teach them self-massage techniques and sometimes even self-taping techniques, which I didn't really throw in yet. But they'll teach them certain techniques that they can do on their own to move the fluid and to keep it going. And if there's a loved one or a spouse or someone that can help with like the lymphatic massage, we can definitely help train them in terms of the treatment approach and how to do the manual lymph drainage too. So I would throw that in as the 5th component, is that you definitely want to learn how to self-manage, because for a lot of people with chronic swelling and lymphedema, it is just that. It is a chronic problem. If you've had damage to your you've had lymph nodes removed and you've had scar tissue and things like that, it may be something that you have to manage as opposed to something that you're able to cure and just move on from. But again, that's all part of the education process if you're working with a lymphedema trained therapist who really knows what they're doing and can answer all those questions for you. So I hope the video helped and just gave you an idea of the overarching principles with lymphedema treatment and chronic swelling treatment. These are all the videos I have planned for right now, but maybe after taking a few weeks to think about it, I'll be able to post some more specific videos on maybe some of the exercises or the manual lymph drainage techniques and stuff like that. So that's all for now. This was the 3rd video in the series. I hope you enjoyed it, and if you have any questions, I'll leave my email below the video, and then you can certainly visit our website where we've got some more resources up there too. So there you go. Thank you for watching. Have a great day.